introduce myself. My name is Agny Idzatty and I'm from class 2A. Here I will explain the resume about the video that I have watched. One of the biggest threats to patient safety during surgery is surgical site infection, namely infection of the part of the body where surgery is performed. Heart professionals try their best to prevent this type of infection by rubbing the hand and arm up to the elbow before surgery, maintaining a normal constant temperature during surgery, and thoroughly cleaning the skin at the surgical site. But the death rate caused by surgical site infection is increased. Has forced her healthcare professional to consider every possible way to disrupt the surgical environment, including minimizing traffic in and out of the operating room. Research shows that opening and closing door during surgery allow the entry of bacteria carrying particles which pose a risk of infection. While a closed door policy is not possible due to today's dynamic operating room environment, there is no doubt that reducing traffic in and out of the operating room during surgery will go a long way in reducing the risk of infection. Researchers saw that a 5-step problem-solving exercise can reduce the movement by up to 7-8%. And so the researchers implemented an intervention called the AG report among a team of 4 heart professionals working in an orthopedic operating room, an orthopedic surgeon, and anesthesiologist, surgical coordinator, and quality coordinator. The AG report is a problem-solving tool that originates from the fight of lean manufacturing of wide concerned with maintaining customer value while minimizing the work and cost involved in reporting 5 main steps. 1. Define the problem. 2. Determine the current situation. 3. Determine the ideal situation. 4. Analyze the gap between two situations. And 5. Take action to improve yourself. By adapting this process to the operating room environment, the surgical team identified 3 primary causes of traffic during surgery: unclear size among team members regarding entry and exit during surgery, lack of visibility of the operating room telephone number, and ambiguous no entry sign during surgery. After surgery, propose and implement fixes to eliminate the root of this problem. The number of the movement decreased drastically from about 24 times per hour to 4 times per hour over the 6-month follow-up period, a reduction of 7-8%. In other sorts, I learned that death and complications due to surgery can be prevented. One way to prevent this can be done with a surgical safety checklist. Surgical safety checklist is a communication tool to patient safety used by a professional team in the operating room. The professional team consists of nurses, surgeons, anesthesiologists, and others. The surgical team must consistently carry out every item carried out in surgery, starting from the breathing phase, the time out phase, the breathing phase, so as to minimize any unwanted risk. Several studies on the use of WSCL have resulted in 1. Surgical safety checklist can reduce mortality and complication. 2. Reduce surgical site infection and reduce the risk of blood loss of more than 500 milliliters. 3. Reducing the proportion of patients who don't receive antibiotic until skin incision. 4. The most common function is providing detailed information about the case being worked on, confirming detail, articulating the focus of the discussion, and forming a team. 5. Using paper checklist in one solution because paper checklist can be provided quickly and require little cost. Besides that, paper checklist can also be adjusted in size and shape according to needs and don't require high level of technological mastery to fill them out. Maybe in a few Thank you. Wassalamualaikum warahmatullahi wabarakatuh.